Hope you're all having a great day. I am popping on here today because I want to discuss one type of pain, type of pelvic pain, and that's perineal pain. And of course, as some of you may know, it is May, and that is Pelvic Pain Awareness Month. So that's why I wanted to shed a little bit of light on perineal pain. So, first of all, what is perineal pain? If we have a look at a pelvis, it's probably easier to discuss it in this manner. When I see the front of the pelvis here, first of all, the perineum is the area between the entry of the vagina and the anus. So this is the perineum. And so perineal pain is pain that is presenting in this region here, just south of the vaginal opening. So that's simply stated what it is. My top 3 causes of perineal pain are, first of all, scar tissue. So some individuals who have had surgery or who have had a vaginal delivery, perhaps any sort of cut or laceration around that area can cause scarring of the tissue. And as we all know, scar tissue can tend to heal really stiff and tight. And if that happens, there's a little bit less flexibility. So that can create some pain for some individuals. Another cause is dryness. So there can be some dryness in that tissue. This can be common for the sort of pre and post-menopausal population. And this can actually be of concern to some people after having a baby. In both of these populations, there tends to be some fluctuations in hormones and a decrease in estrogen in most individuals in these 2 stages of life. So that can absolutely contribute to more dryness. And just like if we had dry lips and if we smiled, sometimes our lips will crack. Same thing can happen in that area. So around the perineal area here, if there is dryness, here and then that area is stretched at all, perhaps with penetration or intercourse, then that can create a cracking in that region, which can also cause more pain. Okay, and the last one I wanted to discuss today, the 3rd cause of perineal pain, is muscle tension. And we've sort of talked about how pelvic floor muscles, all of these muscles here, these are all pelvic floor muscles. Perhaps I haven't gone over the muscles with you yet, but these muscles can actually get really tight. So just like my shoulders can get super tight, if those pelvic floor muscles get tight, of course, it can create more resistance around that entry. And if there's any less sort of flexibility or play, again, if penetration is attempted and there's excessive tension, then that can also exacerbate perineal pain. So I hope that helps. Again, that's what perineal pain is, and my top 3 causes of perineal pain are scar tissue, dryness, which can cause fissuring or cracking, as well as muscle tension.